Good morning, everyone. My name is Maya Luria with TMC for Seniors, and this is our second presentation today for Diabetes Day. We're going to be talking about core confidence, enhancing circulation, strength, and stability with diabetes. I have Mike Urquhart here with me. You may recognize Mike. He has been here many times with TMC for Seniors. Mike is with our cardiac rehab program and always does an incredible job in sharing so much good information that I think you're going to find helpful today that's going to be related to your diabetes. How are you today, Mike?
I'm doing well. Thank you, Maya. I always enjoy speaking in your programs and, just getting a lot of feedback and everything. I'm excited.
Great. And, so Mike, you have such a vast educational background and knowledge. I mean, you are a research physiologist, you're a biochemical pharmacologist, professor of biology, you're an exercise physiologist. So, I just want people to know that because I think it's important. You've really done a lot of research, particularly when it comes to, exercising and just sort of the intricacies of everything. So thank you so much for being here today.
Certainly. Thank you, Maya. Thank you for inviting me. So, yes. So, hello, everybody. Hello. How are you guys doing today? So, so my background, I do have a huge background of experience, and mostly because, growing up as a young teen, I became very curious about medicine, and I became very curious about how things work within the body. And I'm probably not on camera, am I? I became very curious about how things work in the body. And so when I was in college, I studied biology. Followed that, I was basically a phytogeography. I don't know if you know what phytogeography is, but phytogeography is determining the terrain of any given place by looking at the plant life. Because different plants, they need to grow in different environments. And if you know what that plant is, if you know the physiology of that plant, you can determine what kind of environment they're growing in as well. But anyways, that's where it kind of all began. And then I became very interested in metabolism and muscle cell metabolism, nutrition, and biochemical pharmacology. One of my early research jobs was looking for active metabolites in candidate malarial compounds. Mm-hmm. And so that's, I did that for 7 years. And actually, I am heir to Nobel Peace Prize. But yeah, so the molecule that I worked on was transitioned to clinical study. And that group of researchers actually got the Nobel Peace Prize. Nobel Peace Prize in medicine. But anyways, Nobel Prize in medicine. But anyway, so I'm not here to talk to you about that today. I'm here to talk to you about diabetes and what exercise, especially core strength, can do for your diabetes. And because I am an educator, I just can't start with diabetes. Let's go really deep. So diabetes. I know there was an MD here earlier, but even the MDs, they don't tell you this stuff anyways. But diabetes really means a siphon. It really means siphon. And that siphon and how it works in your body, because I'm a physiologist, so there's anatomy, there's physiology. Anatomy is a structure. Physiology is how that structure works. And that's what I really did. I studied the workings of the body, not just the little bits and pieces of the body, but basically how those body parts work and what they do to function. And so anyways, diabetes means siphon. And it's all about how your body is handling water. That's what that actually comes from. That's where it comes from. It's a water siphon. And so in talking about that, there are probably 3, maybe 4 different types of diabetes nowadays. There's type 1 diabetes. Type 1 autoimmune disease usually happens when you're young, when you're a child. They're looking for cures for it. They're getting very, very close. But typically people with type 1 diabetes, They get that early in life. They know how to work with that as they progress through their life. They know how to adapt to that. And then, of course, there's type 2 diabetes, which happens a little bit later in life. A lot of people are diagnosed, that's the key word, diagnosed with diabetes somewhere, sometimes as early as the mid-40s, the 50s, sometimes 60 years old. But that's the diagnosis. Most people will have hyperglycemia or have the symptoms of type 2 diabetes 10, 15 years before they're diagnosed. And a lot of times that diagnosis is because, maybe you haven't gone to see your doctor. Maybe you haven't had the A1C test or the glycosylated hemoglobin test, which we'll talk about a little bit too. But anyways, and then there's diabetes insipidus, which nobody really talks about so much. That's actually an actual disease dealing with water and how your kidneys are handling that water. And a couple other hormones that regulate the water in your body. And then the fourth type of diabetes that's coming around now is the type 3 diabetes. And type 3 diabetes is being very closely associated with dementia and Alzheimer's. And it's kind of the same mechanism as type 2 diabetes, but it has a far greater effect on the brain and the nervous system. So, all right, I am a professor. I'm going to ask you some questions. So we're talking about glucose. Glucose. How is glucose made? Do we make glucose? Yeah. Once again, do we make glucose?
Yes.
No, we do not make glucose. We do not make glucose. We eat glucose. And the only place glucose can come from is this right here. It's a plant. It's a plant. That's where it starts. And through a process known as this very elaborate process, you take carbon dioxide and water in a chemical reaction, and you form glucose, C6H12O6. And that's what the molecule looks like, glucose, right there. Plants do that in a process known as photosynthesis. Yeah, it's written up there. You guys read it. Photosynthesis, yeah. So right now on a beautiful day like today, plants, they're making glucose all the time. Plants store glucose. They store glucose, one, as just regular, what we call plant sugar, fructose, or as starch. And they also use glucose to make their woody or their herbaceous tissue, make them plants. That's what plants are. Notice fiber to us. When we eat it, we eat the fiber, and that fiber is used to, give bulk to our, you can say it, stool. You can say it. Did you say it? Stool, yeah, it gives bulk to our stool. And we need that. We need that. We need that bulk. We need that fiber. But anyways, so we can have glucose, as it is right here. This is called a monosaccharide. But typically, we don't eat monosaccharides. We usually eat disaccharides and polysaccharides in the form of starch. But those disaccharides are just different combinations of glucose and one other molecule, an isomer of glucose. So there's glucose, there's galactose, and there's fructose. And once again, that's plant sugar. That's what makes honey so sweet. It's that fructose. And so when you combine glucose and fructose together in that disaccharide, we get, wait for it. Oh, well, sorry. I'll come back to that slide. We get this. We get what we call sugar, table sugar. This is in everything. Everything. Anybody have a beverage in here that's not water? Coffee? I heard people drinking coffee out there. Yeah. Did you put sugar in that? Oh yeah, because it's diabetes thing. There's okay. If you read carefully on there, there's probably a little bit of sugar in there. Even though it might be, low sugar or no sugar, or there's still a little bit of sugar. They can call it low sugar and no sugar because they don't put the same amount that they do their regular product. And so you still get sugar because there's still calories in there. Or it might say 0 calories, but it's from a dietary standpoint, it's not enough calories really that your body can do anything with, so they can call it 0 calories. But it's there, believe me, it's there. But so, yeah, sugar is a combination of glucose and fructose. That is a disaccharide. Do you know eating sugar, it's harder to stop a cocaine habit. I'm sorry, it's easier to stop a cocaine habit than it is to stop a sugar habit. Yeah, it really is. It really is. I wouldn't know. I wouldn't know. No. But anyway, so what do we do with that sugar? I'm going to show you. It's this right here. Glycolysis. I mean, we can call this anaerobic respiration. Anaerobic respiration, meaning that we can derive any energy from this without oxygen. But glycolysis does have a second step, and that is the aerobic portion, where we do utilize oxygen to help metabolize it a little bit further so we can get a little bit more energy from it. But two things happen at the end of glycolysis. We produce ATP, or the leftover is stored as glycogen and or fat. Too much sugar makes you fat as well. Too much sugar makes you fat. But anyways, through this process, it's 10 steps. I want you guys to memorize this because you'll be tested on it. No, the biggest thing that I want you to take away from this is how we generate ATP, or energy, adenosine triphosphate. And we use ATP for everything in our body. This is all building up. It's culminating. I'm going to tell you at the end why we do this ATP, why we need that. There's a story involved. Don't worry. There's a story here. So, we talked about when you are diagnosed with diabetes. You know, that can be 7, 10, 15 years, and you already have what is known as hyperglycemia. Hyperglycemia. Mm-hmm. And hyperglycemia is an inordinate amount of glucose in your blood. These 3 graphs that I have up here, this first one is showing normal blood glucose levels. Normal blood glucose levels should be somewhere between 70 and 120 milligrams per deciliter. Okay? That's normal. So if I were to prick your finger right now and measure your blood glucose, I don't know if you ate last, but it should be 100, 115, somewhere around there. Now, of course, if you've just eaten a meal, it's going to be a little bit higher. It's going to be a little bit higher. But normal situation, resting, fasting blood glucose levels should be between 70 and 120. Okay? Some places, maybe a little bit lower, 60 to 100. Depending on what doctrine you read, it'll be different. Now, the second condition that we have here is called hyperglycemia. Hyperglycemia. Now, just like I just said, after you eat a meal, your blood glucose levels are going to go up. They could go as high as 250, sometimes even 300, depending on what you ate. Birthday cake, right? I don't know. Sometimes even just potato will get your blood glucose levels up pretty high. But that's because your body is now metabolizing, it's processing those disaccharides and polysaccharides down to smaller and smaller chunks, and then you end up with glucose. And that's what's floating around in your bloodstream. That's glucose. Okay? So when you guys leave this room today, you will no longer refer to your blood sugar as blood sugar. You're going to refer to it as your glucose, because we don't have sugar in our arteries and veins. We have glucose. Sugar doesn't exist in our body. Once we eat it, it gets broken down into the smallest form called glucose. Now, after we eat, yes, your blood glucose can go high. But what happens if it stays high too long, that's when we have hyperglycemia. And if it stays high too long for several days, that's when we start having issues. That's when we start having all of the symptoms related to hyperglycemia. I didn't say anything about diabetes yet. That's not diabetes. That's not diabetes. But once again, diabetes is only determined by a blood test. Oh, and then this last one that I have here, this is the hypoglycemic or hypoglycemia. And hypo just means low blood glucose levels. Now, that condition exists sometimes as well. Sometimes after eating a very high sugary meal, and if your insulin is working like it should, that insulin is going to cause your blood glucose to drop fairly quickly in some people, and it can go low. It can be in that low condition. Or if you do have some sort of disease process, you could stay in that low position for a while as well. But for the most part, your blood glucose, your body has these checks and balances, these negative feedback loops that keep it in that area between 70 and 120. I have to eat because my blood sugar is low, unless you have a disease state, and I have to say that because sometimes people do. Unless you have a disease state, your blood glucose never goes low. It never goes low. Your body releases another hormone. You hear us talk a lot about insulin, but there's another hormone called glucagon. Glucagon is released almost in the same area, different cells within your pancreas, and glucagon is released to raise your blood glucose levels. So in times of fasting or starvation, or if you're running a marathon, or if you're doing something like that, exercise and you haven't eaten, your body's going to release glucagon to keep your blood glucose levels up. Okay? Yeah, it will. But once again, unless there's a disease state, then we have other issues. But that's rare. That's rare. I'm sorry?
You're sick sometimes.
Yeah, if you're sick. So your blood glucose levels can go up if you're stressed. You know, a lot of the secondary treatment that I see when I'm in ICU after open heart surgery, either valve replacements or coronary artery bypass grafts, secondary treatment is to give the patient insulin, because that shock, that stress will cause your blood glucose to rise. And that slows the healing process. And so they give them insulin to keep that blood glucose down. That doesn't mean you're diabetic. In most cases, insulin is stopped once you leave the ICU. And so, in fact, some of the step-down units, they don't even give insulin because they're just not authorized unless the patient is predisposed or has that, does need insulin because they are diabetic. So, as we move forward, you heard me talk a lot about, glycosylated hemoglobin. This is what happens when your blood glucose levels stay too high too long. Glucose, glue, the reason why it's called glue is because it's very sticky. It sticks. And if you spill something sugary on it gets really sticky. Well, the same thing happens in your body. That glucose will stick to your hemoglobin. And then that's called glycosylated hemoglobin, or HbA1c, or as we say it on the streets, hey, what's your A1C? Hey, buddy, what's your A1C? How many people know your A1? Do you guys know it? Okay, all right.
Could you explain the process one more time? about the sticking?
Well, it just sticks. So the next molecule on this slide, this is your red blood cell. And it's a proteinaceous molecule. When you look at it, your hemoglobin, and that's the molecule we're looking at, is a protein that's associated with your red blood cell. The glucose will actually stick, and as you see in this green portions right here, if you can see the green, that is glucose sticking to that heme group. What's supposed to be sticking to that?
Oxygen.
Oxygen. And on the way out, what?
Carbohydrates.
Yeah, exactly. And so if glucose is stuck there, where's the oxygen going?
Nowhere.
Nowhere. So
Nowhere to go.
exactly. So either that oxygen is not being absorbed by the body, or it's acting as a free radical, causing a lot of problems in your body as well. But that's not what we're here to talk about. We're here to talk about those A1Cs. And so when we talk about the A1C, normal is below, and once again, whatever doctrine you read, it might have different ranges. If this is coming from a Jardiance document, they would say your A1C should be 5.0 because they want you on Jardiance anyway. But it just depends on what you read. I'm a research physiologist. I have seen it all. I've seen all spectrums of what that should be. But what we do know is that above 6.4 to 6.5, that's diabetic. That's diabetic. Okay? Pre-diabetes, that's that gray area. Some doctors will give you a get out of here and just tell you to change your diet and exercise. Some doctors will say, hey, I'm going to put you on metformin. And you'll be on metformin for the rest of your life. And they won't even check your blood glucose. They won't even check your A1C again. They'll just tell you to take this. And, your A1C is going to come down. Maybe a year or so they'll check it. But really, truthfully, they should check your A1C at least every 3 months. And it's that 3 months that determines how well you are maintaining your blood glucose levels. How well you're maintaining your blood glucose levels. Yeah. Oh, yeah. Sorry, it says that up there. And so once again, your A1C. So why is this so bad? Why is this so bad? Higher A1Cs, they definitely lead to what is called the apathies. And one of the apathies that I'm going to talk about right now is microangiopathy. Microangiopathy. So I have a couple of different pictures here. This first picture over here on our right-hand side, your left-hand side, is the normal condition of your vessels, your arteries. We're going to focus on your arteries. Let's focus even more. Let's get a little bit closer. Let's focus on the arteries because I'm in cardiac rehab, because I deal with cardiac patients all the time. We're going to focus on the arteries of your heart, your coronary arteries. High A1Cs, in a normal condition, this is your arteries, nice and wide open. That membrane is nice and thin, very flexible. It can dilate, it can constrict as needed to increase, decrease your blood pressure, to increase, decrease your circulation, to do whatever it needs to do. And that's what our blood vessels do. They change in size according to what we're doing, the temperature or mood, you name it, it goes on. In the second condition, however, this is hyperglycemic or hypoglycemia. Hyperglycemia. And if it's not maintained, having high A1Cs, above 6.5, 7, 8, 9, 10%. I've seen people, well, I haven't seen them too long, but I have known people that had 14, 15% A1C. Okay? Now,
What's the normal A1C?
normal A1C is about 5.5.
That's what I thought. Yeah.
About 5.5. So in the hyperglycemic condition, your blood vessels become thickened. It reduces the size of the lumen. Sorry, the lumen is the opening of your blood vessels. That's the path in which the blood flows. In the hyperglycemic condition, high A1C condition, it thickens your blood vessels, narrowing that lumen. I mean, that's fine. That's okay, right? No, not really. Because if you combine that with a little bit of atherosclerosis, that's a natural thing. It starts happening depending on your exercise and your diet. It starts happening when we're about 15 years old, and it progresses significantly about every decade of our life. Typically to about, late 50s, 60s, that's when we really start noticing the effects of it. But here, let me throw this at you. We can control the atherosclerosis by exercise, eating right foods, right? You've heard that before. You're not hearing that the first time, right? Yeah, you've heard that. But so let's say you do have, and most people do, let's say you do have a little bit of plaque buildup in your arteries. In the normal condition with a wide open lumen, your doctor's going to give you the out of here. See you in a year. Come back, we'll make a follow-up visit. This, in a normal condition, this is probably, I don't know, maybe 10, 15% buildup, right? I'm just throwing a number out there. But, and the hyperglycemic the high A1C with this thickened blood vessels and, constricted lumen, that same amount of plaque is now a problem. That's 50, 60%. So that is why diabetes is so closely related to cardiac issues as well. And I'm saying cardiac because that's what I deal with. But you know what's happening in your heart? It's happening all over your body. It's not just in your heart. That's what leads, and this is microangiopathy. Let's talk about some of the other opathies. Neuropathy, right? Nephropathy. Everybody's heard of neuropathy. Not a lot of people hear about nephropathy. What is nephropathy? Well, that deals with your kidneys. So if your blood vessels are thickening up in your kidneys, that's acute kidney disease, AKD, or just kidney disease. Because now your body's not filtering the blood properly. And that leads to other issues. Okay? I'm kind of painting a very gloomy picture, aren't I? Yeah. But there is good, you guys know there's good news at the end of this, don't you? But anyways, I just want you to realize what's going on with diabetes, not to be taken lightly at all. And why? Well, hold on. I'm going to wait till next. But then we have retinopathy. Retinopathy, that's when we, as we get older, we think we need glasses, but it's because of this. That lumen, the lumen in your blood vessels is getting smaller, not delivering oxygen, not delivering nutrients to the retina of your eyes. Sometimes you end up seeing spots. That's retinopathy associated with diabetes. But it's all the same thing. It's that, the blood vessels getting thickened. And then we're back to the microangiopathy, which, if I haven't covered it, I already said the heart, but once again, it happens all over your body. The coldness, the tingling, the poor circulation. That's where that comes from as well. Part of it. Leads to diabetic foot. Kind of a bad condition because of the neuropathy, because of the microangiopathy. Somebody will injure a toe, and because of the neuropathy, you don't feel it. It doesn't get treated, gets infected, and because of the poor circulation, there's no nutrients, no oxygen, that tissue dies. And a lot of times, the person doesn't know it for quite some time. And then we have to lose a toe. And if it's bad enough, you have to lose a foot. And we've all seen it. We probably have friends that have had that. And you're like, what? How does this happen? Well, that's how that happens. That's how that happens. So, but it's not going to happen to you guys, is it? Nope. Nope, I know, because I'm going to give you the secret. Real quick. Can I charge for that? Can I charge for the secret? This guy, does anybody know who Hippocrates is? I know I have the answer.
Greek author, medicine. He had a lot of ideas which were wrong, like levers and let's get into it.
Yeah, perfect, yeah. Hippocrates, yes ma'am.
I didn't hear what she said.
Oh, father of medicine. Father of Western medicine, modern Western medicine, but ancient Rome. But the reason why I have this guy up there, Hippocrates, way back then, way back, ancient Rome, he said this: walking is man's best medicine. Walking is man's best medicine. It really is. And this gave proof that even just simple activity can help maintain a healthy lifestyle. He said walking. You know, I know the Greeks historically, early, they didn't live very long but they had other issues to deal with. There was war, there was disease, diseases that we, kind of laugh at now, but they didn't have any protection against those diseases there. But mostly it was war, and that lowered the lifespan. But nowadays, if you were to compare, my Ph.D. is in cross-cultural comparison of different cultures in health and medicine. If you compare those cultures together, the Greeks would have outlived us by 50 or 60 years in our modern age, even though we have all the modern technology. If we had given them all that modern technology and they maintained their lifestyle and reduced their warring, they would exactly. They would have outlived us. But walking, man's best medicine. Exercise, physical activity. So, bottom line is exercise. Write this down or highlight it. Exercise will maintain your blood glucose levels. And now we're going to go all the way back to that. Our body goes through this process to make energy. The more energy we expend, the more we have to break down glucose. In that process of glycolysis. Glycolysis, I didn't tell you this earlier on purpose. Glycolysis means glucose splitting or sugar splitting. I didn't want to use the word sugar, but glucose splitting. And that first step right there, glucose is split. It is cleaved. C6H12O6, it is split so that your body can make ATP. Where does that sugar come from? We can go back a couple more slides. Do I need to go back a couple more slides?
No.
Where does that sugar come from? Our food. So, to get off on a nutrition standpoint, if you're eating the right foods, we don't have to worry about the bad sugars either, do we? Yeah. But I'm not talking about nutrition, I'm talking about exercise. So the more we exercise, the more energy we need. So we have to split more sugar. And that sugar comes from the food we eat, but it also comes out of our bloodstream. We eat it, it circulates in our bloodstream, we have activity, and our body uses that sugar. If we don't have activity, then our body will store that sugar and or it will start sticking, adhering to our blood vessels, causing all the apathies. Did I diagnose anybody with diabetes yet? They didn't say you were diabetic yet, did I? We're still just kind of talking about hyperglycemia. The only person that can diagnose you with diabetes is an endocrinologist or your primary care through a blood test. And you get that A1C back and they go, you know what? You're 6.0. You're diabetic. But all this time you're hyperglycemic. The way to bring down that hyperglycemia is to exercise. Is to exercise. I think you had a question for me. So, Mike, what kind of exercise should I be doing? Thanks for that question. Well, you know, really any kind of exercise. But I'm going to tell you right now, core exercises, because our body, are you sitting up in your chair right now? No, everybody's slumping. I see you guys slumping out there.
We're not stopping, we're slumming.
Yeah.
The chair's
Yeah. So your core, what is your core? Your core are your stabilizing muscles, your back, your abdominals, your legs, your calves, your soleus, your gracilis. All of those muscles are your core muscles. That's what helps us stand upright. That's what gives us all of our stability when we walk. But when you sit down, when you're resting, if you are engaging your core, you're burning more calories. You know what? I'm going to use you as an example. If you're slumped over in your chair, you might as well be laying in your bed, laying on the couch, because you're not engaging. You're not burning extra calories. I'm just kidding. I'm just kidding. But you want to engage that core. Okay? Build up those muscles, because your core muscles, they're operating 24/7, or they should be. And that's where you're going to burn the most calories. Yeah, it's one thing if you go to the gym and you put in a couple bicep curls and run on the treadmill for 10, 15 minutes. That's great. But then you're done. You go home. But you spend most of the time on the chair or the couch. But if you're activating that core, you're going to be burning more calories throughout the day, reducing that glucose level in your blood even more, reducing your chances of diabetes, reducing the apathies. That's what it is all about. Take every opportunity, as Hippocrates said, to do simple exercise. Walking. I don't care how you walk. I see a lot of canes. I thought I saw a walker earlier, but I see that as well. That is okay. You have to get to that somehow, don't you? Okay, yeah, probably for long distances you need that, but yes, getting to your chair, you have to walk. In our world, and this is where the Greeks won out. In our modern world, we have so many conveniences. First of all, we have a car. Do we really need a car?
Yes.
Really? Really?
Yes.
Really though? How many
Some people do, you're going across the street, but
Yeah. How many people have lived in like New York City? Yeah. Did you need a car in New York City? No.
Yeah,
How many-
subway buses.
Yeah. And you had to walk to those.
Yeah.
You couldn't just like
Everything
boom.
was close by.
Exactly. But you had to walk to it. Just that little bit, and you did it multiple times.
Yeah.
Has anybody visited Europe? Who's been to Europe? Germany, France, anywhere. Their whole thought behind the automobile is completely different. It's not a convenience in Europe.
Exactly.
For us, it's a convenience, it's a luxury. How many of you have a Mercedes-Benz out there? Yeah, I know you do. I saw somebody roll it. No.
Porsche.
Or Porsche. But anyway, so walking. Now, I know there might be some walking issues, but here's your opportunity to challenge yourself. Today is what, Wednesday? For the rest of the week, when you go somewhere, Costco, that's a good place. Walmart, I don't care where you go. I want you to park far away, and I want you to walk to the door. Don't take that front close parking spot. Well, only if you want your door dinged. If you want your doors dinged, yeah, park in that front parking spot. But if not, yeah. Park out so you can get that little extra walk in. Now, the doctor that was here earlier said you had to have how many steps? 5,000? That's nice. You know what? She was going easy on you. It should be 10,000.
Yeah.
Should be 10,000 steps. Should be 10,000. I don't know, maybe if she wants to come back in, we can have a little challenge. But,
Oh,
But-
how do you take those steps for?
how often?
I mean, you guys got 10,000 steps
Every day.
every day, 10,000 steps?
Every day, 10,000 steps. Every day. Now, I know there's some limitations. You got to do what you can do. You got to do what you can do, okay? And how you can do it. You know, Hippocrates said walking is man's best medicine, but there's a lot of other activities out there as well. Do what you find is enjoyable to do, okay? Swimming? Yeah? Pickleball? No, not so much. Football? No. Okay. Well, it's just walking. That's why I like to say walking, because almost everybody can do it. Almost everybody can do it. Dancing! Oh my gosh. I'm glad you said that. When was the last time you went out dancing?
2 weeks ago.
2 weeks ago. Good. When was the last time you went out dancing? Why can't you dance every day? Why can't you dance every day? You can, can't you? Now, I'm not saying you, if you can dance, I'm saying go through movements of dance. I don't care if you have any rhythm or not. But you can do that. You don't have to go to a party to go dancing. But there are dance clubs you can go to. Dancing is a very enjoyable form of exercise, and you should do more of it. Okay, just like you're walking. But back to the core exercises. Once again, it's increasing the strength of your muscles, your core muscles. Your muscle mass, the more muscle mass that you have, the higher your caloric expenditure will be. You can, anybody can build muscle. I don't care how old you are. Anybody can build muscle. You can increase the metabolism of your muscle just by exercising, doing some resistance training, doing some sort of strength training, which is a little bit different, but you can also do some static exercises as well. I have listed up here, some examples of core exercises. I just threw these up there only because they're popular ones. You don't have to do push-ups or planks or crunches or wall sits, although we're going to do something very similar to that right now to help build your core strength. Is everybody ready? Okay. So all we're going to do is we're going to do a static squat. I'm going to demonstrate. Everybody at home, if you can hear me at home, if you can see me at home, be careful in your home. If you need extra support, please do so. You can use another chair, you can use your friend, you can use whatever you want to. But let me demonstrate. This is a static squat, and there are 100 different ways you can do a static squat too. I'm going to show you the most basic. All you're going to do is just put your hands on your chest and just go down and hold it. This is a static squat. Now somebody's going to ask, how long do I have to do that? Well, like someone asked me earlier, how much should I swim? Well, it's up to you. you've got to gradually build up until you get that base, and then you can start building on it. Challenge yourself a little bit. Yeah. And that's really what it takes. So once again, static squat. Static squat's kind of cool because you can put your hands wherever you want to. You can put them on your thighs, cross them on your chest, put them on your head, overhead, out to the side, behind you. If you need extra support, you can put your hand on the chair. You can do whatever you want to. But I will tell you, I did some exercise this morning. Probably after about 30 seconds, I'm going to start really feeling it in my legs. So we'll probably only do it for 10 seconds. Jen, can you count 10 seconds for us?
Okay.
All right, so this is what I want everybody to do. Be very careful. I would like for you to stand up if you'd like to participate. Of course, you can do this at home. It's very simple.
Let's see.
I don't have any, wait, not yet, hold on. I know you guys are enthusiastic. So we're only going to do this for 10 seconds. Once again, let me demonstrate. You can put your hands wherever you want. I'm going to put mine on my chest, and I'm going to go down and hold it. Okay, are you ready? On 3. 1, 2, and 3, down. We're going to hold it 10 seconds. How are we doing? So one thing that helps the time go by quicker is talk. Or sing, sing the alphabet, something, and recover. Shake it out a little bit. There's your dancing. That's how it starts. We'll do it one more time. Ready? We're going on 3. 1, 2, 3, and down. There we go. We're doing good. And I don't have anything else to talk. What should I say? All right, please have a seat. But that is a great core exercise. In order to hold that position, you're engaging your abdominals, your low back, your legs. If you do that enough, you will increase your caloric expenditure to reduce your glucose in your blood. You know, I was going to put a graph up here. I was going to put a graph on, but I decided not to. I spend my days in cardiac rehab. One of the criteria in cardiac rehab, if you have diabetes, is we monitor your blood glucose levels, just to make sure they're not too high or too low. Everybody that we check when you are diabetic in cardiac rehab, we check before exercise and we check after exercise. Before exercise, they're up here. After exercise, which is about 40 minutes, they're down here. Everybody.
Same day?
Same day, within 40 minutes. 40 minutes. And I'm not going to tell you that this is hard exercise. This is moderate activity. Moderate activity. In 40 minutes, some people will drop their blood glucose over 100 points. 100. 100. So that's how you can maintain your blood glucose levels, by exercising, core exercising. Now, of course, I do have to throw in a little nutrition here. I teach nutrition as well. If the food that you're eating is kind of a tannish color, that means there's probably a lot of very simple carbohydrates in it. And we're looking at, orange juice, sugar, jelly bellies. This is all, I call this a monochromatic American diet. Everything on your plate is the same color, and it's usually beige. And that's very high in sugar. Introduce some color. Utilize that food color palette. Like that. Look how pretty that looks. Look at that. Now, not only, you're still getting carbohydrates, but you're getting carbohydrates in the form of, one, starches, the complex carbohydrates, and fiber that we need. We're also getting a lot of vitamins and a lot of minerals from that as well. Whereas This diet right here, I couldn't even tell you what minerals you're getting from this. I know this is orange juice, right?
Yeah.
But orange juice, that you might as well drink like sugar water, because they've taken out all the good stuff to give you orange juice. Basically, it's orange flavored sugar water. But those foods are very scant in protein, in minerals, and vitamins that we need. Yeah, it's filling your gut so that you're not hungry, but it's not about filling your gut. It's about filling your soul. You can write that down. Not about filling your gut, it's about filling your soul. So, and I know the physician that was here earlier, and I'm just glancing on this. Medications for diabetes. Some medications increase your levels of insulin, tell your pancreas to produce more insulin. Some medications increase the sensitivity of your cells to uptake the insulin that you are producing. And some medications are insulin, strict insulin, to tell your body, hey, you know what, you're not producing insulin, here's insulin, to help you regulate your blood glucose levels. Make sure you check your blood glucose level. Your PCP or your endocrinologist is probably giving you specific instructions to monitor your blood glucose. That's what's important. That is what's important. Yeah, it's one thing you're taking a medication, but if you don't know where your blood glucose levels are, what are you doing? And if they have it, you need to talk to them. Talk to your physician. But there's several ways you can do it. There's that CGM, which is really cool. Now they have it's an app on your phone, a little dot on your arm, and you never have to do a finger prick, and it just monitors your blood glucose levels throughout the day. Now, typically, they will only give CGMs to patients that are on insulin. But I know it's becoming a little bit more loose with that because it has shown a lot of positive results in people knowing their blood glucose levels. I'm going to tell you a little secret. A lot of professional athletes, they are doing that on a down low. It's because they have team doctors, they have physiologists, they're working with them. It's really important that we maintain your blood glucose levels. So we're going to monitor your blood glucose when you are training. And that's how they're doing it. I mean, it's probably not, I shouldn't whisper that. It's not really a secret. And then the other way to monitor your blood glucose levels is, with a glucometer. Sometimes they're really small. I've seen some really small ones now. The one that we use in the hospital is about the size of it's about that big. But you do have to prick your finger. And cardiac rehab, we do that twice in about the span of an hour. We do it before and we do it after exercise. And that's when we see that big drop in blood glucose. So, here we are at the question portion. Maya, do you have any questions from people at home?
I do, actually. I do have some questions, Mike. Thank you. So one of the questions that came in was regarding GLP-1s, right? Because we know that a lot of people are using a GLP-1 these days and that can affect your muscle mass and maybe your bone density. What can you do about that if you are on a GLP-1 and you want to maintain your strength?
The only answer I have for that, and this is what it is the only answer for it, you still need to exercise.
Okay.
You still have to exercise to maintain your bone density and to maintain your muscle mass. Just going on a GLP-1, that's not the end all be all. Yeah, you'll probably lose a lot of weight, but that's for a small segment in time. If that starts coming back on, then they have to keep increasing the dosage of that. And that's not ideal.
So, right. So really you need to if you're not exercising, you should be exercising while you're on that GLP-1 as well.
Yes, exactly.
Okay. Do you need to, should somebody be looking at whether there needs to be maybe an adjustment in their medication, their insulin, or a meal plan because of increased exercise?
In the beginning, there could be some huge decreases in blood glucose, but I know a lot of cardiologists, a lot of endocrinologists are hesitant to adjust those levels until they see the progress of that patient. A lot of times people, they will say, oh, I'm going to start exercise for, a couple of weeks. They see huge decreases in blood glucose and say, well, I need to decrease my insulin. Well, let's wait and see. Let's see how that behavioral modification stays in place before we really change too much with the medication.
Okay. And do you have any exercise tips for people who may experience pain in their feet due to diabetes?
Yes.
That's obviously a big topic, right? Is maybe some neuropathy or some foot issues.
Exactly. So some of the alternative exercises for people with pain in their feet is to take the pressure off the feet. Swimming. I mean, hopefully you can swim, or just spending time in the water with water aerobics, step aerobics in the water. Things like that are great for people dealing with pain in their feet. Other exercises, I mean, there's a lot of exercises you don't have to stand up. You can sit in your chair. You can do weights. You can do leg lifts. You can do, yeah.
Maybe a recumbent bike.
Recumbent
perhaps,
bike. Right,
Okay.
exactly.
Yeah. Okay, great. I want to thank you so much for getting everybody up out of their chairs. So that they can sort of experience that. I'm going to wrap up with our online audience, and I'm going to send it over to you for any in-person questions. Thanks so much for being here, Mike.
Excellent. Hey, thank you, Maya. I
Thank
appreciate
you.
it. Thank you.
Thanks so much for being with us today. We are going to be back with more diabetes talks next week, so we hope that you can join us. On Tuesday, November 11th, we've got Diabetic Wound Care Essentials, What You Should Know. That is with Natalie Norum, who is a nurse practitioner with TMC1. She will be presenting on Tuesday, November 11th at 11 a.m. Our next topic after that is going to be blurred vision, navigating macular degeneration and diabetic eye disease. That'll be on Wednesday, November 12th at 4 p.m. If you're interested in either of these classes, please give us a call and we'd be happy to get you registered. Our phone number is 520-907, 520-324-1960, 324-1960. Thanks so much for joining us today for Diabetes Day, and we'll see you again soon.